So today's webinar is all about the Achilles tendinopathy. So what is Achilles tendinopathy? The Achilles tendon is the largest tendon and the strongest tendon in the human body, but is more prone to injuries such as tendinopathies. Achilles tendinopathy is more often a painful overuse injury, and it's quite common among athletes, especially those who are involved in running and jumping sports, but it is not just an athletic injury. 65% of injuries diagnosed in general practice are kind of not sport related anyway. And with Achilles tendon injuries, this is kind of the case as well. It can be kind of categorized as either insertional or mid-portion tendinopathies. So that just depends on whereabouts on the tendon the tendinopathy is. And is often described as degeneration or failed healing due to continuous overload. So what are some of the symptoms of Achilles tendinopathy? Pain, reduced function, they're kind of the primary symptoms of Achilles tendinopathy, but it's often described as a gradual onset of symptoms that include stiffness in the morning or after a prolonged sitting. There is pain with touching it and activity, as well as some deficits with strength or performance if you're performing a sport or within working. Often an early symptom is pain at the start of activity, which then kind of reduces within the kind of training session or within the activity. But it's not uncommon for people to experience kind of reduced performance before the pain, and then the pain kind of follows after that. Often when the minor symptoms are ignored, it can be kind of progressed to something that's much more painful, lasts a lot longer, and then you kind of suffer more with the consequences afterwards. So reduced performance, reduced muscle mass, things like that. So what are some of the causes of Achilles tendinopathy? It's kind of multifactorial, the different types of risks that are associated with Achilles tendinopathy, either intrinsic or extrinsic. Some things that kind of relate to it are kind of the decreased load of tolerance of the tendon or movement patterns that kind of overload the tendon. They're kind of the main factors that cause it. But there are other things such as decreased plantar flexor strength. So as you can see on the picture there, dorsiflexion and plantar flexion. So a lack of strength in that kind of upward and down movement of the foot, as well as deficits in hip neuromuscular control, abnormal ankle movement, so limited ankle movement, increased foot pronation. So that's like on that diagram there, the E version. So kind of going in on your ankle. As well as increased body weight, leg length discrepancy. But there also is some evidence that kind of supports the footwear being something that impacts it, or even sport participation, training load errors, not having enough recovery time. So the intrinsic factors kind of a lot of the time include the biomechanical abnormalities. So like we've mentioned before, the leg length discrepancy and the hyperpronation and things like that. Whereas the extrinsic factors are normally kind of excessive overload, kind of obesity, training changes, things like that. The Achilles tendon is a mechanoresponsive, which means that it adapts to the load and demands that is placed on the tissue. The most common cause of Achilles tendinopathy is often kind of excessive loading without the right amount of recovery time between training sessions. However, that's not always the case. It can be kind of increases in work or daily activity, and kind of the compressive forces onto the Achilles tendon, and the heel bone from certain types of footwear or activities and things like that. It can even kind of be caused from uphill running because your foot's in that kind of stretched position of your Achilles. So what can be done about it? So the first line of treatment is always going to be non-invasive. Things such as activity modification, orthotics, heel lifts, massage, hot and cold therapy, strengthening exercises, ultrasound, and anti-inflammatory drugs. The treatment with the kind of highest level of evidence is exercise rehabilitation. The purpose of this is to provide load to the tendon and kind of promote it to remodel, decrease the pain, and improve some of the calf muscle endurance and strength, as well as the lower leg function. Rehabilitation can kind of be split into 4 phases. So first off, it's going to be symptom management and load reduction. So I'm not kind of cutting out exercise. You just want to reduce the exercise. Next would be recovery, and then rebuilding and returning to sport or your activity that you're missing. Often the therapist that you're going to see, it will take a thorough history of the injury itself, its kind of progression, and it's important to understand this and the symptoms to know what's irritating the tendon, as well as kind of how to address the load reduction as well. Complete rest and tendon unloading can be absolutely detrimental to your recovery. It can even prolong your recovery. The most important part with Achilles tendinopathy is managing your load and just reducing it rather than completely eliminating loading onto your feet. So as I mentioned before, orthotics. So these help to support the feet into a more supportive position so that the Achilles tendon is kind of better positioned for optimal use. They can also help to decrease any kind of leg discrepancy, kind of leg length discrepancy, and limit any overpronation, which are some of the kind of causes of tendinopathy. It can also help if you're a runner as a shock absorber. But here at T4 Physio, we can make bespoke insoles. So we scan your feet and can get a kind of picture about what's going on, how you're kind of weight bearing, whether any of these kind of biomechanical issues are something that affect you. And then we can get these insoles into production in the clinic with the 3D printer and can get you kind of on your way with the insoles. But they are a good thing for helping to get you back into your kind of activity, you're exercising or you're running and things like that. Some other methods of treatment can also be considered with Achilles tendinopathy, and some of these include corticosteroid injections, shockwave therapy, and even possibly operations. So what we want to try and do is obviously avoid operations for as long as possible before kind of getting to that point. So some of the methods that I mentioned, so corticosteroids, they work to relieve the pain by reducing the inflammation that occurs in the tendon. It can produce short-term pain relief after the injection, but some people don't get any relief from it whatsoever. And then they've just had an injection. Shockwave therapy is another treatment option. So with shockwave, microtraumas are produced into the tendon with repeated shockwaves to the affected area, which then stimulates new blood vessels. The new blood flow promotes tissue healing and also relief from pain. The shockwave therapy can also inhibit kind of your pain receptor function, so it can help reduce some of that pain as well. Like I said before, as a kind of last treatment method, operative treatment can be done on the Achilles. It involves removal of the abnormal tissues and lesions, and the main goal of it is to remove degenerative nodules, restore kind of vascularity, and stimulate the cells to initiate an inflammatory response, which is what we want to kind of then help with the healing process to put it on its way. So if you're struggling with Achilles tendinopathy or want to discuss how insoles or how different treatments can help you, and how we can kind of help your symptoms, then you can book in at T4 Physio for your free 15-minute consultation, and we can get you on your way and back to your activity.